There are common prescription medications sitting in medicine cabinets across millions of homes. Pills that were prescribed by doctors, filled by pharmacists, and taken daily for years without much second thought. But there's something rarely discussed in a clinical setting. As the body ages, especially after 60, the way it processes medications changes significantly. What once was safe and effective can behave differently over time, not because the medicine itself has changed, but because the body has. Older adults metabolize drugs more slowly, have reduced physiological reserve, and are often managing multiple conditions at once. Yet, many prescribing decisions are still based on studies that didn't fully reflect this complexity. This isn't about stopping medications abruptly. It's about awareness, about understanding what is often not explained during routine visits, and about having informed conversations with healthcare providers. Let's look at a few commonly used medication categories that often require closer review with age. 1. Calcium supplements. Calcium is essential for bone health, but supplementation is often more complicated than it appears. In food, calcium comes with other nutrients that help regulate how it is used in the body. In isolated supplement form, that balance may not exist in the same way. Over time, researchers have raised questions about whether high-dose supplementation without proper context may have unintended effects in certain individuals, particularly when dietary intake and overall balance are not considered. A more modern approach focuses on getting calcium primarily from food sources and ensuring overall nutritional balance, including vitamin D and magnesium, rather than relying solely on standalone high-dose supplements. 2. Proton pump inhibitors, PPIs. Medications used for acid reflux, such as omeprazole and similar drugs, are highly effective and often life-changing in the short term. However, they are frequently continued for much longer than originally intended. Long-term use may affect how the body absorbs certain nutrients, including vitamin B12 and magnesium, and may require periodic reassessment. In some cases, lifestyle factors such as meal timing, diet, and weight can play a significant role in symptoms and may reduce reliance on medication. For those who need ongoing treatment, regular monitoring and periodic review with a healthcare provider are important. 3. Statins. Statins are widely used to manage cholesterol and reduce cardiovascular risk, especially in people with a history of heart disease. For many, they are an important and evidence-supported therapy. However, like all long-term medications, they are not without considerations. Some individuals report muscle-related symptoms or fatigue, and in aging populations, overall energy metabolism naturally changes. Because of this, ongoing evaluation of risk versus benefit is important, along with regular follow-ups to ensure the treatment still aligns with current health status and goals. 4. Long-term pain relievers, NSAIDs. Over-the-counter pain medications like ibuprofen and naproxen are commonly used for joint and muscle pain. While effective, regular long-term use may not be appropriate for everyone, particularly older adults. As kidney function and stomach lining protection naturally decline with age, sensitivity to these medications may increase. This makes periodic reassessment important, especially for chronic use. Alternatives such as physical therapy, topical treatments, or targeted anti-inflammatory strategies are often explored depending on the individual case. 5. Sleep medications. Certain sleep aids, including sedative hypnotic medications and benzodiazepines, are sometimes prescribed for insomnia. While they can be effective in the short term, long-term use in older adults requires careful consideration. These medications may affect balance, alertness, and natural sleep architecture. Because of this, many clinical guidelines recommend periodic review and, when appropriate, gradual tapering under medical supervision. Non-medication approaches, such as sleep hygiene, stress management, and behavioral strategies, are often part of a broader long-term plan. A real-world pattern. Many people take multiple medications for years without revisiting whether they are still the best fit for their current stage of life. Not because anyone is doing anything wrong, but because healthcare systems often focus on starting treatments more than reevaluating them over time. The goal is not fear, it's awareness. Aging changes physiology. And when physiology changes, medical decisions sometimes need to be revisited as well. Closing thought. If there is one takeaway, it is this: medications should evolve with the person taking them. Regular review, open dialogue with healthcare providers, and awareness of how aging affects the body are key parts of safe long-term care. Not everything needs to be stopped, but many things deserve a second look.